males in the United States, prostate cancer is the number one cancer, followed by lung cancer and colorectal cancer.
Thank you all for joining us. I'm Calvin Johnson, and this will be a night of education.
It's about 1 in 8 of men will be diagnosed with prostate cancer in their lifetime. If we look at certain population subsets, like let's say African Americans, they have much higher incidence. So for African Americans, it's actually 1 in 5. Unfortunately, for African Americans, prostate cancer is more prevalent than in other populations. The cancer starts to grow, there might be very minimal symptoms. Usually, people don't notice that they have cancer until it might be too late, when the cancer already spread and causing symptoms. But fortunately, for prostate cancer, we do have a really nice screening tool, which is very cheap, very simple to do, and it's a simple blood test called PSA. Early detection is very important. For African Americans, we recommend beginning screening for prostate cancer at about age 45, which is a little bit earlier than for general population. Usually, screening starts at around 50. And the screening starts with the discussion with the family doctor that I want to be screened, and the test gets ordered. And then once the results come back, then the doctor discusses what the levels are, and they can discuss if it's abnormal or if it's normal. The screening is recommended to be repeated once a year. And the PSA is high. So what's the next step? So the next step should be a referral to urology. That's usually what happens next. And urologists can help determine if this elevation of PSA in the bloodstream related to cancer or something normal. Sometimes people with a little larger prostates can have elevated PSA, and it doesn't mean that they have cancer. But the urologist is a specialist who can order additional tests, and they can determine whether a biopsy is required to confirm if there's a cancer in the prostate. As part of the evaluation, nowadays, a lot of people will be screened with MRI of the prostate. It's a special MRI scan that allows to see prostate organ in very great detail and identify even small spots in the prostate that are abnormal. And then it helps urologists to target those abnormal spots specifically to determine if those spots have cancer or not. But anyway, it helps the urologist to target the specific zones that are at high risk and obtain a tissue biopsy from that specific point. And then the pathology results come back, and urologist discusses that with the patient, and if there is a cancer, then the treatment gets discussed and the further steps in, let's say, diagnosis. So being diagnosed with prostate cancer doesn't stop there, because once someone has on the pathology a result that there is cancer, we want to know how bad the cancer is. Prostate cancer is actually a spectrum. Some people with prostate cancer can live their whole life and get no treatment, and they will be fine. The cancer will never bother them. On the other spectrum, people may have prostate cancer that is very aggressive and can spread very quickly and take someone's life very quickly. So for us doctors, it's important to identify who are the patients that we can safely monitor and who are the patients that require treatment right away. So typically this is kind of determined by pathology. So there are certain factors we look in the pathology For example, one of the factors is the Gleason score. You may probably heard about Gleason score. What it is, it's a number that helps us identify how aggressive the cancer cells are. The higher the number, the more aggressive the cancer cell is. So, for example, if someone has a Gleason score 6, it's considered a low Gleason score, and usually those people can be safely observed with their cancer. But if the Gleason score is 8 or 9, that tells us that it's quite aggressive cancer and needs treatment right away. There is also additional scans that we can order to help us identify if the cancer has spread. Traditionally, we used to order scans like CT scan of the chest, abdomen, and pelvis to see if the cancer has spread. In addition, we were ordering the bone scan to see if the cancer spread in the bones, because prostate cancer is known to spread to lymph nodes. It can spread to bones, it can spread to liver and lung and cause issues, and we need to identify that as early as possible. There is a new scan on our in our toolbox, and that PET scan is actually can help us identify even small pieces of cancer that CT scans won't show, which is very useful and helpful because we can target those spots with specific therapies. And that PET scan is actually can help us identify even small pieces of cancer that CT scans won't show, which is very useful and helpful because we can target those spots with specific therapies. So this is the process that starts before even discussion of the treatment. So once all the evaluation kind of steps are completed, then doctors sit down with patients, discuss them, and then the treatment plan gets developed. So for everyone, this treatment can be like, there's so many different approaches for treatment, and it depends on many factors. It depends on the stage of the cancer, the health of the person, the symptoms that the person may have. So, and the doctors help to select the best approach possible.
Anthony Douglas, will you tell us a little bit about your journey and what you've experienced?
For me, I go to the doctor annually and get a checkup. And due to doctors retiring, I had a new doctor who actually was introduced to me by a relative. And she was very thorough in everything. After a couple of years, I had mentioned to her that I had not had a PSA test or prostate exam in a while. So she said, well, let's do a, excuse me, let's do a PSA and we'll see what happens. So when I went back to the doctor, he said, well, your PSA was a 4.8, up from a 4.6, which seems to be somewhat normal for African-American men, but you're slightly elevated. And she said, so, Anthony, what I'm going to do, I'm going to have you do an MRI. And within a short amount of time, which I was very thankful, within 2 weeks, I was taking I had an MRI done. And in the MRI, it stated that there was something in my prostate that definitely could be cancerous. So she said that you need to see a urologist, which I had already had one. And I scheduled an appointment with him, which so happened to be within 2 weeks. And when he met with me, he said, yeah, I'm going to do a biopsy, scheduled within 2 weeks. So it really worked quickly for me. And I thank God for that. I did the biopsy within 2 weeks, March 3rd of this past year. He called me in, wife and kids were there. And he said, you have stage 1 prostate cancer. I said, and I looked at him and said, well, okay, what are we going to do? And that was my attitude. At this point, I wasn't afraid of the word. I realized that this is something that I had to go through, and I had the right people around me to help me go through it. And I told her, I said, you know what, prostate cancer is prevalent amongst us as African American men. And I don't want to hold my voice through this. And I want to be transparent with it. I want to be open, because me getting cancer and being detected at an early stage, I realized I was assured that this is curable because you're stage 1. And I said, what if I would have let that go? The symptoms that I had was very small. You know, we go to the bathroom and use the bathroom, and sometimes you may strain a little bit, you know, disposing of your urine. But as men, we kind of feel like, oh, that I can handle that. That's nothing. But not knowing that that's a symptom of prostate cancer, and if you don't take care of it, it will spread. So I was happy that I learned about it early, and then it was my opportunity to share my voice through it. I had no problem in the journey that I've taken with prostate cancer. And whenever I get an opportunity to meet with a group of men, no matter what, I make sure I take time out, and I ask if it's an event that I could talk to the men about prostate cancer. I tell them, make sure you get your PSA done. Make sure when you go to the doctor, you get a physical, have them do a PSA so you'll know where you are, just in case, because the symptoms, sometimes they're hard to detect for us. And we endure pain sometimes, or being uncomfortable. And sometimes we don't want to talk about issues of that, that's that private. So we just keep going through and say, we'll be okay, it'll be all right. But no. So it was a history for me that I didn't know of. And now that knowing that, you know, I have a son, I have, brothers. I have a brother who's dealing with prostate cancer now. But I tell my son, I said, you know, it's prevalent in your family, so you got to make sure that you're getting tested for your prostate cancer.
So early detection is important, because the earlier the stage is, the treatments are less intensive for prostate cancer, and the cure rate is much, much higher in comparison to when someone has more advanced disease. It's much harder to cure, plus the treatments will be much more intensive. And sometimes they require several modalities. It could be radiation plus injection of hormones. It could be chemotherapy. So it's very important to get detected early. So very, very important, get those PSA checks every year.
And this is a good conversation for the barbershop. You know, as we're sitting there just kind of chewing the fat, a lot of times we don't talk about the practical things that are really happening in men's life. And that is the way to get the word out that, hey, man, if you haven't been checked, you ought to be checked. And then also look into your background, just like Anthony did, to find out what is going on.
My journey was a little different because I'm one of those old black men that don't like to go to the doctor, you know, and don't go often enough. I'm working to go to the doctor more often, more consistently. But about 2 years ago, I think my doctor asked if I wouldn't have a PSA test, and we had the test, and it was elevated. And she decided at that point, like, we don't have a benchmark, so let's wait 6 more months, get another test, and then we'll have a comparison. Of course, I waited a year before I went back. And I actually didn't go back for a PSA. Spring of last year, I was at the urinal and I saw blood in my urine. You know, that was a big flag, right? And so that drove me back to the doctor. And that's actually when I went and got the second PSA test. And it turned out that my PSA level was 29, which is really high. And it was also the blood in the urine. It wasn't clear whether that was a bladder issue or a prostate issue, because that can be a symptom of prostate cancer. So I had an MRI and a CT scan to examine that. And it turned out that I actually had bladder cancer and prostate cancer. And they thought there was actually there was something abnormal from the CT scan on my pancreas as well. And so that was terrifying. Like this range of possibilities. But with further testing, the bladder cancer was caught early. So last spring. So the question was, what do we deal with first? How do we address these multiple presenting issues? And we decided to address the bladder cancer first. And to remove the tumor that was there. So I had surgery for that last in June of last year. And once that was dealt with, we focused on the prostate. That involved a biopsy. And the biopsy showed that, well, the the CT scan had also shown that I had enlarged lymph nodes. And so they wanted to do a biopsy of the lymph nodes and the prostate. And I had a great team as well. I felt really good about my urologist and my radiation oncologist. But because of it had spread and had moved outside of the prostate itself, radiation by itself wasn't enough. So I'm currently continuing to do androgen therapy, hormone therapy. As I understand it from my doctor, and again, I'm gonna let the doc correct me if I don't have the right understanding about my own body. See, this is why we got to educate ourselves, right? But the prostate cancer it thrives on testosterone, and that it's important in terms of the treatment for the particular cancer that I have, that my testosterone has to be cut off. And it's not only testosterone produced in your testicles, but there's adrenal glands on top of your kidneys also produce small amounts of testosterone. So I have every 6 months an injection to block testosterone production from the testes, and then daily huge pills that I take to block the production of testosterone from adrenal glands. And it's really having made a decision that I need to take my own health into my own hands and to really be serious that if I want to live, and I just had a 2-year-old granddaughter now, that I'm pretty committed to seeing grow up. My framework that I've been working with for the last year or so is that I'm going to live another 15, 20 years. I'm going to beat this. But this year I just got to get through this very miserable year. It's, and it has been fairly miserable at times. Not totally debilitating. Like, as y'all, many of you know, I'm still active, and I did 40 radiation treatments. I would go to treatment at 8:00 in the morning, and I'd be at my job by 9. And I taught my classes, and I did the things that I normally do. But I cut out a lot of my community activities. But it's been a journey, and what's been startling over this past year that I've shared with a number of brothers in the community, that this was my diagnosis, just from going through it. And I've been surprised at how many other men have said, oh yeah, I got that too, or I know somebody who's got prostate cancer. And it runs in my family as well. My grandfather, deep South Carolina, he died in, it's like a lot of Black folks down there. Family wasn't sure what he died from, but in doing a little more digging, he died from prostate cancer that had metastasized to his bones. And my father and my brother both have enlarged prostates. Fortunately for them, it's not cancerous, but it's an issue that they need to deal with. And I also have a son that I want to make sure that I need to get as much information about my health so I can pass it on to him, so that he can look out for his health and so on. But I think it's important for us in the community, the way that breast cancer is something that Black women have to deal with, and Black women have been dealing with, and we talk about that, and that women are much better at talking about those kinds of issues. We as Black men have to be equally willing to communicate with each other, so that we can look out for our whole community.
Years ago, or a few years back, it was a digital rectal exam along with the PSA, the blood read. Is that still true, or is it just the blood read?
So typically, if someone is getting screened for prostate cancer, then blood test is usually enough. But if someone has a problem or a symptom, or if the PSA is high, then we always do a prostate exam because it helps doctors to identify, number one, are there any nodules that might be of concern? Is there any problem in the rectum itself? It also helps us to select what treatments we want to do. There is something unrelated to prostate cancer that I kind of want to mention. It's actually colorectal cancers. Sometimes by doing prostate exam, we find those. And unfortunately, in African American population, colorectal cancer is also appears to be higher than in other men. So it's kind of important to get screened and make sure that it's not just a screening for prostate cancer, but also screening for colorectal cancer.
For Dr. Sparks, I just wanted to know if sugar really does feed cancer.
Well,
Certain foods.
Yes and no. So the cancer cells are very highly metabolic cells that require a lot of energy to grow, spread, metastasize, and they will go for the easiest source of energy to do that. And the easiest source of energy is sugar, meaning it's a simple sugar. It's a glucose that's floating in our body. So the cancer cells will obviously strive if someone is overdoing sugars. But the difficult concept becomes when someone is actually eliminating a lot of sugars that might be good, like, for example, fruits and vegetables that are packed with other nutrients, in fear that even that can feed cancer. So that actually probably more detrimental to the body because it doesn't provide enough nutrients that are more helpful. And the cancer cells are so smart that they will obtain that sugar even if someone is not consuming it from the outside. So our sugar metabolism is very tightly controlled by hormones. So you have insulin, you have glucagon. Those are two main players that control the sugar in the body. And our body is very sensitive to a level of glucose in the bloodstream. So when the glucose drops below normal level, we usually cannot function. And some people might have experienced that if they are on insulin or if they're taking medication for diabetes. As soon as the sugar goes below normal level, you need to have something like a candy or something to bring this up. So we as human beings, we cannot function without sugar. But the important point is that overdoing simple sugars is not good for the body, and it's not good on many levels. It promotes inflammation. It makes us feel not healthy, and certainly if you're overdoing sugars, it can make cancer worse.
My question is, after you've gone through the treatments and been cured of prostate cancer, what is the percentage of the possibility of it coming back?
So it actually depends on the stage of the cancer that was treated. So the earlier the stage, let's say if it's a stage 1 or 2, the cure rate with appropriate therapies can be as high as 90%. For people who have a little bit more advanced cancer, it drops. So it drops to 80, maybe 70. Sometimes we say to people, it's 50-50, but there's still a chance. So it's kind of all depends. That there is a very good resource for everyone. It's free. It's called NCCN guidelines. N as an NC, CCN as an NC guidelines. National Comprehensive Cancer Network guidelines. So you just need to register. It's free. And once you register, then you can search any type of cancer and the guidelines will outline the available recommended treatments by stage of the cancer. And you can kind of cross-reference that if you got recommendation from a doctor, does this follow the guidelines? And the guidelines are very good because it's a panel of specialists that actually put them together. They put a lot of research into that, and everything actually has references in terms of research. And we as a medical doctors, we actually follow those guidelines. That's where the recommendations are coming from.
Thank you to Gladys and to Karen for sponsoring tonight's event. I think it's been very informative. I would like for each panelist to take 1 minute and kind of wrap up the conversation for tonight.
Okay, first of all, I'd be remiss. I mean, the many prayers that were given to me, I really do appreciate. But I would definitely be remiss if I didn't thank my wife for being by my side through the whole journey. Yeah. I think she was definitely much more worried about me than I was. But I mean, having her there and my family and friends really helped me through my journey. So I really do thank my wife for being there with me. Yeah.
Well, it was an honor to be here. And, I probably learned from you guys as much as you learned from me, just hearing these stories and journeys. Also, nutritional information was very informative. And thank you so much for having me here.
And I just want to thank Karen and Gladys for this whole idea of the Purple Couch Initiative, because I think the key is that we in our community have to be talking to one another and like not hiding stuff, but to really be open and sharing and giving to one another. That's how we're going to build.
I just want to thank God, because I've been asking him for years, why do you have me here? Why am I doing this? And he's revealing to me, this is why he had me go through the 19 years of study, analysis, experiences, and working with people, so that I can at this moment say, this is the kickoff for what my real calling is that's to talk to us.
And if there's anyone, family members that are dealing with the things that we're dealing with, I recommend Dr. Sparks as someone to sit down and talk to.
We want to thank each and every one of you for coming tonight. Now, your homework is to go spread the word. We can't have conversations like this without sharing it with someone so the rest of the community benefits.